So the idea to create an initiative to get students more involved in innovation began back in 2017 at our first Vet Futures student meeting. We felt as students it's very easy to focus solely on what we're taught in our curriculum and not consider how new changes, innovations and technology will reform the career we hope to go into. So earlier this year, we launched the What's Your Big Idea? Dragon's Den competition in collaboration with ViVet. I'm so pleased to introduce our 3 finalist teams, and I'm sure you'll be as impressed as I am with the ideas they have to present. Our team submitted their preliminary ideas and have been working with our mentors and industry experts to produce their presentations for the Dragons today. I'd like to say a huge thank you to Rue from VetLed, who helped us pair our teams with mentors tailored to their idea. A big thank you to our mentors, Ben Sweeney, Stacey Blees and Caroline Scooby, who've supported our teams throughout the competition. And finally, a thank you to Alexander McGee and Pete Richards from Covetrus, who supported our teams in preparing their presentations. I also wanted to take this opportunity to say a huge thank you to Sophie from ViVet, who's been invaluable throughout all of this. She's really made it happen, and she's given veterinary students this brilliant opportunity. So thank you, and I'm going to introduce our first competitor, and that is Madison Hewitson from Nottingham.
Okay, hello everyone. My name is Maddie Hewitson. I'm a final year vet student from the University of Nottingham, and today I'm going to be talking to you about my innovative idea, which is the Innovate app. Did you know that 36% of owners are dissatisfied and would not recommend the veterinary care that they are receiving? The Innovate app aims to change this. Throughout my time seeing practice, I have noticed an ongoing theme of problems which I believe need to be addressed, not just for the dissatisfied clients, but for the veterinary profession and the animals involved. One of the clearest problems is owner compliance. Owners want what's best for their animals, but despite seeking and spending money on veterinary care, they frequently fail to follow their vet's instructions. A 2003 study published by the Veterinary Times found that owner compliance was only 64%. This suggests to me that something is going seriously wrong and needs to be addressed. Miscommunication. Whether this is between the practice and the client, or between the vet and the client, it can have serious consequences, not only on owner compliance, client satisfaction, treatment of the animal, but business of the practice and the mental well-being of the veterinary profession. The average consulting time is 10 minutes. In this time, the vet not only has to gain a history of the animal, but also complete a clinical exam, a diagnosis, and come up with a treatment plan for the animal. Now, if this wasn't hard enough, every year the population of pets increases in the UK, with last year the UK reaching a new record of 9 million pet dogs. Hence, it is no surprise that vets are pushed for time more than ever before, with catch-up slots now being replaced by more consultations, frequently causing vets to run behind, miss breaks, and finish late. This leads me nicely onto my final issue, which is poor mental well-being in the veterinary profession. Vets have a 4 times higher suicide rate than the national average. One of the contributing factors to this is long working hours and stressful working environments. This can lead to also, anecdotally, quicker staff turnover in practices. The Innovate app aims to reduce the amount of stress put on these veterinarians and to hopefully reduce the figures that we are seeing. All of the problems aforementioned are interconnected, in particular, poor owner compliance. To give you a common example, imagine that you are a vet in this scenario. Mr. Smith brings in his cat, let's call him Brian. Brian has received not the full course of the antibiotics that you have recommended to Mr. Smith, but instead he informs you that he had stopped giving them before it was due. Now, not only is Brian potentially going to suffer an increased illness over a prolonged period of time, but this could also increase the risk of antibiotic resistance, which we all know has serious consequences on the public health of humans. Now, whether the importance of completing the full course of the antibiotics wasn't properly portrayed to Mr. Smith, or that he simply forgot as he left the consultation room, as lots of people do, including myself. However, all of this will attribute to Mr. Smith now being less satisfied with the treatment that he has been provided and is more likely to not recommend the treatment of this practice, or if anything, go to another practice to seek veterinary attention. So what if I told you that I had a solution to this? An app, where clients can access information about their pet from their vet. An app that increases communication between veterinary practices and their patients, provides numerous opportunities for repeat consultations, and increases interaction between public and veterinary profession. Increasing client satisfaction, reducing miscommunication, hence increasing owner compliance, and further increasing practice efficiency. All with the ultimate aim of improving animal health and welfare and making the lives of vets, vet nurses, and clients easier. Technology is severely underused in the veterinary profession, and I think that the benefits could be outstanding. This quote from Covetris, I think, summarizes it quite nicely, in that technological solutions can increase patient communication, improve diagnostics, and reduce error and labor time, as well as greatly enhancing the quality of patient care. The problems that I have mentioned are common knowledge within the veterinary profession, which is why I was so shocked when I carried out market research that nothing like the Innovate app was in existence. So, let me talk you through the app. As well as receiving daily tips and advice, which can be filtered to the species that they have registered on the app.
Technology is severely underused.
Sorry about that. Owners can also book appointments, request repeat prescriptions, and pay bills. Owners can also create a customizable profile for their animal, which they can store important information about their pet on, including the age, the sex, the species, the medical conditions, their next appointments, and their outstanding bills, which they can turn notifications on and sync to their calendars on their iPhones or Androids. The owners also have ability to record glucose and create a glucose curve, as well as recording heart rate, rest rate, urinary output, and water intake, which they can all share with their veterinarian for enhanced veterinary care. The app also provides a kind of veterinary filter on a Google search. 25% of owners Google their animal symptoms before seeking veterinary advice. This is why I think it's very important to create a safe, reliable, and accurate place that owners can refer to seek information about the animal. The ability for the vet to share the treatment plan or the disease discussed in the consultation with owners is particularly unique to this app, in that when the owners go away, they can click on the information that has been given to them during the consultation, and the hyperlink shown will take them to information that has been stored on the app, and there's also videos that are available for them to refer to, which vets can also use during consultations to enhance the discussion with owners. So how can we bring this app to fruition? The main challenge for all startup companies is funding. Depending on which app design company you go with, the average price for developing a minimal viable product is around £20,000 to £50,000. Adoption of the app by clients and practices I do not see as being a great challenge because it provides benefits to everybody who uses it. To produce a usable product, I will be conducting continuous market research and app trials. I think that it's important for the app that it would be trialed in situ in a few veterinary practices that would be happy to trial this out with their customers. Via this, we will receive feedback and information that we can use to create and further develop a product that can be released to the general market. The success of the app would be measured via customer usage, client and veterinary satisfaction, increased animal health and welfare. All of this information can be recorded and analysed via questionnaires, interviews, and app information that we would receive and gain from the clients and the practices. So, this is the Innovate app, where clients can access information about their pet from their vet. I'd love you to embrace the Innovate app because I do truly believe that it is a game changer for the veterinary profession. I've been Maddie Hewitson and thank you for listening.
So I've got a question
Okay.
for you to start with. When I'm thinking about what a good innovation looks like, I think about one that has the potential to deliver good reward, and you've certainly described the reward that we've got here. But I also think about one which has got sort of the lowest risk reward ratio in its development. What do you see as being the biggest risks in the development of this product, and what measures would you take to reduce those risks?
I think probably the biggest risk would be, although during my market research I did not find any apps that were even slightly remotely related to the Innovate app, but I am aware that there are big corporations that are investing in creating similar apps. Now, I do truly believe that from the information that I've received about the apps that are being developed, that they not only do not contain half of the information that I would provide to practices and clients, but I think that in a crowded market, only those who can make and keep a real connection with customers will truly thrive. And I think that using all of this veterinary information, which I have done throughout my studies, has shown me that it can be quite dull to look at. Patients don't really want to, the clients don't really want to engage with these. It's hard enough for me, when I understand, to engage with them in the first place. Yes, you want it to be informative and official, but you also need to engage and relate to customers. And I think that my app, and I would probably consult a branding company as well to further improve this, to make it more engaging for the clients.
Thank you.
Thanks so much for your presentation. I just have three quick questions. Mm-hmm. One is if you could dig down a little bit deeper in terms of competitors. You said that there's no product exactly like this on the market, mm-hmm. but it seems to me that you are actually competing with a lot of different types of products. So what are they, and which ones do you think you have to look more deeply at? The second one is, in terms of scope, do you think you might be going a little bit wide? Just one small example. For example, appointment software. There's probably really good appointment software out there. So is that something that needs to be, and how do you reduce the scope to perhaps not try to be everything to everyone? And the final question is, in terms of content validation, if you're trying to outdo the information that people get on the internet by using Google, how is the vet going to have time? What are going to be the sources of the information, and what's the validation process?
Okay, so to address your first question, which are other competitors in different areas, so you may be aware that there is some software that is available to create glucose curves, for example, and send this to your veterinarian. The point with this app is that not only does it enhance on those apps, because I've looked at the feedback from them, and the feedback is terrible. People don't know how to work them, they can't interact with them, they're not engaging. This not only improves on what's already out there, but it puts it all in one place, which makes it easier to use, which makes it easier to sell to clients, to practices, and then to address your second question, which was
scope.
The scope. So, do I think I'm looking too wide at this? I don't think I am. I think that there's a market out here for this app. I think that, yes, it is including a lot of information, and the information, to answer your third question as well, would be I've researched into some apps which provide only a slight part of this app, and they have adapted the information that they have on their apps for the clients from places like VetStream. So you would be using official sources of information and putting them in one place for vets and clients to use together. Yes.
Yeah, they said that time's up, so maybe we can let you answer the question to the next.
Yeah, no, that's no problem. Thank you. Time's up.
Thank you very much. Thank you.
So, good afternoon everyone, my name is Lauren and this is Rohilla, and we are final year vet nurses from the University of Bristol. So, to start, I would like you to imagine a world where breeders and veterinary professionals could work together to save the lives of more puppies. Challenging, yes, but actually we think we have the answer with our Helping with Whelping app. So what is the current problem? We have got only around 7,000 human babies dying every single day. That is a lot. That is a very, very large statistic. But hospitals have found that when they introduce hospital services, especially midwifery services, they can reduce this by up to 70%. Now, that is a very shocking statistic. We have found that with puppies, we have got nearly 560,000 puppies born every single day. Now, the 2015 breeding report was the newest piece of data we could find that we could use to estimate that on. Mortality rate in puppies is believed to be around 20%. Now, 20% is shocking. And we think, based on that data, around 100,000 puppies are dying each day. If we can save even half of those, that is 50,000 puppies we could help bring into this world. We think one of the main problems is that we're still seeing, in veterinary practices, we're seeing animals as emergencies rather than preventative options. And, you know, to evolve the field of veterinary medicine, we would like prevention to be the route we go down. So why do we think this is happening? The main point that we would like to get across is the breeders versus veterinary professionals. I don't know how many of you in here have had chats with breeders. They are often quite difficult to have because the breeders understandably have a lot of experience in this field. There is absolutely no denying that. They see the normal births that we as veterinary professionals, we do not see. I know in 3 years in practice, I've seen 2 cesareans, and that is it. And if you were to ask me to recount a normal birth, I would probably struggle to do that because we do not see it. And we want to know why we're not seeing it. Why are we not getting this sort of relationship with breeders? Because after all, we are working towards the same end goal, which is the welfare of the mum and the pups. We would like education in this to be raised. As nurses, we only get about 2 or 3 lectures on struggles that people have during, that dogs have during birth. We do not really have that much education on the normal birth. And the whole sort of idea of this competition was innovation, and we would like to take this further.
So how are we going to do that? Basically, we've designed an app which is going to allow us to collate a lot of information all in one place. Now, the reason we decided to go for an app is because, let's face it, everybody's got a smartphone these days. And we found that about 86% of all pet owners feel comfortable using apps. And one of the main things that people really like to see is their records. Now, this is something that we would like to give owners access to. And things that we would like to include are CPR guidelines, and what to do when things go wrong, but also how do you prep for a home birth? What are things that you're looking out for? 24-hour care, or at least a place that people can go to get advice. And also things like postnatal care. But the most important thing that we would like to add is a pregnancy tracker, which you log onto your app, and the first thing you see where along my pregnancy timeline is my dog, and what am I expecting to see right now at this moment in time? Is that going well? No, maybe I should contact my vet.
So we used the business model canvas as an idea of how we can commercialise and scale up our app. We've looked at market research. We sent out a questionnaire to breeders, and these are Kennel Club registered breeders, and we wanted to work out what the normal birth looks like, what sort of signs are they seeing in the mum, when do they feel that they need to contact the vet for help, and actually if they feel comfortable contacting the vet for help. We had a few responses from breeders, and it was actually really quite insightful. The main point that they listed was that when they came to the vets, their experience, no matter how high it was pushed to the side, and the vet would, you know, what we would all tend to do, take the animal and get on with what we've learned how to do. Actually, the reason we think we're struggling with the communication with breeders is because of this relationship. We would like to work with breeders on our app so that the perception from owners and breeders and the veterinary profession is that it's an all-encompassing app, and lots of people will feel like they've had a part to play in it. So it's not just a medical app, it is also, you know, from breeders that have their own experiences. We've reached out to industry professionals, and we've spoke to, on social media, a lot of nurses. And we got over 200 responses from nurses saying that they definitely felt like this idea was something that they would be really sort of intrigued to get to know. One thing that was highlighted as well is that they thought they didn't have enough education in this area. Therefore, we would like the idea of, if we took this further, to do lunch and learn style things and sort of CPD, where we could get everyone to the same level, therefore ensuring the highest sort of gold standard of care that we could provide. We know that there's a need for this problem, and that there's a need for this solution, because we know that there is a problem there that needs to be fixed.
So where do we see this going? What's the future of this project? We want, as Lauren just mentioned, a CPD and further education, maybe even one day a midwifery course that would, you know, expand the knowledge as far as we possibly could. But the main goal of this is to improve that relationship that we've talked about between breeders and vets, you know, just to make all of this easier for everybody, and just, you know, to make the world a better place with more puppies. And one thing that we want to add, maybe if at some point that was possible, packages that vet practice could adopt, in which we've identified different needs of different breeders to include hip scores for kennel clubs, and blood tests, and that sort of thing, so that we can have a more interactive way of communication. So thank you for listening. But we would like to say that please do invest in helping with whelping, because let's face it, who doesn't want to cuddle cute puppies all day?
Yeah, I just wanted to clarify. You said 560,000 puppies born each day and 100,000 die. Did I get that right?
Yeah.
203 million pups a year.
The Battersea breeding report is where we got the estimated sort of 1,000 puppies die each day. 100,000 puppies die each day, I believe.
Okay, seems very high to me. Have you looked at the commercialization costs for this, your startup costs?
We did have a look at how we sort of, if we were to take this further, and it's around sort of between 50 to 70,000 pounds to realistically set up a startup app with what we would like to include in it, which is obviously a high figure, but that is the realistic cost of starting up.
Does that include a salary for you?
No.
Unfortunately not. But we've been thinking about how we can maybe, you know, get this commercialised. And if we were to include help from vets, they could, for example, buy into the app, which then they could distribute to their clients, their breeders. And each time that someone buys an app, we get a little bit back. And that way, hopefully, maybe over time, we could, you know, get the ball rolling.
So just to kind of pick up on that, I think, you know, in terms of the business model, you've got £70,000 plus some kind of salary to come back on. For somebody who's looking to invest in a company and hand over those, you know, that sort of cash for the development, they're also probably going to be looking for a little bit of something back. Mm-hmm. And so therefore that also then needs to be built into it. So I think that's one element. I just wanted to pick up though on your sort of overall package, because you started talking about developing an app and providing the information sort of through the app. But then you started talking about CPD and lunch and learn, and I got a wee bit confused just as to where the focus was. So presumably the app is for the owners, the breeders.
Yes.
How does that then link back into the CPD and the lunch and learn?
The CPD Lunch and Learn is going to be a way of marketing the app. So we're going to go to vet practices and, you know, say, look, this is what we've got. This is why you should use it. And that way, also, with the information that we're going to be collating within the app, that's going to increase veterinary education, you know, and increase people's knowledge around what's normal, because the idea is that this app is going to be developed with both breeders and vets, so that everybody's information is put together.
Okay, thank you.
How would it be if veterinary students could consolidate their knowledge and build problem-solving skills in their own time, at their own pace, in their own space? VetCase would allow exactly that.
So I'm sure we can all agree that one of the best ways of learning is to put knowledge into practice. And as vet students, we are somewhat limited to the amount of first opinion cases we get to work on, perhaps GMS placements, case discussions, and rotations, although many final year students spend most of their time at referral hospitals. So VetCase is an app that would use case-based learning, allowing students to work through a variety of interactive cases. The first opinion focus reflects a job that many of us will go into once we graduate. And with VetCase, students would be in a stress-free environment with no judgment or real-life repercussions of the decisions made. So what evidence is there? So case-based learning has been shown to promote critical thinking, it contributes to deeper learning, and students found it to be really stimulating, and it increased their motivation and exposure to a variety of cases. Here is data taken from a study that used a small animal case simulation tool. As you can see, student satisfaction was overwhelmingly high, with 94% saying that it helped them develop problem-solving skills, and 92% felt that it provided them with a realistic experience of what they'll encounter once they graduate.
And finally, when surveyed, employers scored their new graduates fairly low on decision making and knowledge of finances and practice. We feel that VetCase would increase students' confidence in these areas.
So these next two slides will give you an idea of how our app would work. So once you've chosen a species area, the app would take you through the same steps that you'd go through in practice. And there will be discussion boards available so that students can discuss cases and ask questions anonymously. So the app would promote independent decision making and also self-assessment throughout. So at this point, the student has written a list of history questions that they would like to ask their client, and now they're comparing what they've written to a model answer. When doing the clinical examination, the app would present students with audio and visual evidence that they can assess. This is an important feature because people have different learning styles, for example, auditory and kinesthetic, so including these different media will enhance learning. The app also encourages a logical approach to problem solving by encouraging students to create problem and differential lists at appropriate moments and to edit these as they go. Now we'd like our app to encompass the challenges of real-life first opinion practice. And so a key feature is finances. So as students select diagnostic tests and treatment plans, the client bill will increase and the client budget will decrease. Cases can also be given further levels of complexity with different client scenarios, or perhaps the arrival of emergency cases simultaneously, which would require students to prioritise and triage. And finally, once they've completed a case, the student will be encouraged to reflect on what they've done. They'll be able to keep track of cases and reflections via a log and complete and set goals as well.
Now, the impact of VetCase would extend way beyond just students. So for universities, our app allows further insights into student learning, and with user consent, anonymous data collection could be used for further research. And the research opportunities are endless, including the possibility of using cases to train artificial intelligence. Employers would be more confident in their graduates' decision-making and awareness of financial challenges. And VetCase would also give vets in practice the opportunity to increase their confidence or even get their head back in the game after a career break. In the future, the scope of VetCase could expand to include cases suitable for CPD, and companies in the vet industry would be able to increase their visibility through submission of cases and including ad banners. Now, our app could also make a difference in vet schools in developing countries. We can provide them with free access to VetCase to empower students where education resources are limited. And finally, our animal patients, who would be our ultimate benefactors.
So we'd initially create a minimum viable product. So this would be a PowerPoint similar to the slides that you've seen today. So this would essentially be free and a way of introducing our app to students to gain initial feedback, which we could then use when we create our app. So we'd initially start with a single platform. We'd go for a web-based app. And we'd start with core functionality in one area. For example, small animal with a small number of cases. We could then reuse the code to increase the number of cases on offer and the species areas. And a template could be created to allow easy submission of cases via a web form. One option to build a case bank would be to work with universities. We could provide them with free access for their students for a year in return for submission and validation of cases. Once our user base is big enough, it would be possible to attract companies to sponsor cases and provide ad banners. The scalability of our idea is essentially infinite, provided we have a server. So what funding options could we look at? So one option could be to partner with an existing medical app, although as they have the infrastructure there already, although we haven't found an app that's quite like ours. Another option would be to partner with a corporate. So if they could provide initial funding, we could provide student users with direction to their EMS opportunities and graduate jobs, and access to our app would be a great benefit for their graduate scheme. Another option, due to the kind of research potential, would be to gain funding from universities. And finally, we could maintain income via individual monthly subscriptions for users.
So VetCase would allow students to consolidate their knowledge and build problem-solving skills in their own time, at their own pace, in their own space. Thank you very much for listening.
Have you, when you've been considering the financials on how to get some return on this, have you thought about have you gone down to the level of what sort of cost it would be for an individual to buy this app? I'm just thinking about the number of vet students there are. Have you thought about that?
We haven't actually looked that much into costs, potentially refer back to the employer survey. We're very typical nearly new graduates who have quite little knowledge of finances.
One of the things you're going to need to do is get the schools on board. Do you have a strategy for that?
So hopefully, if we can explain the kind of research opportunities that they can get from our app, it would provide a great opportunity for them to get some kind of feedback on their course. They could see what areas students do better at or what areas students struggle with. It would provide a new tool for them for teaching. So, and again, opportunities just with the cases without even thinking about the kind of additional interaction with the users of the cases.
You mentioned a little bit about the scalability and how you would possibly do a bit of corporate social responsibility around developing countries. Have you explored any of the other international markets and how, I mean, we've got a number of AVMA accredited vet schools in the UK. Is there a market for the product in North America, for example?
Well, definitely, because so obviously initially the app would be in English, but so essentially any English-speaking vet student could download and use our app. Obviously, we have slightly different diseases that we see more commonly in different areas, but if you start getting submissions from American universities, then obviously the app would be even more applicable to them than it would be even without that.
We've had the dreaded signal on time, so you're lucky.
Thank you very much.
Thank you.